look at where the pituitary and hypothalamus is. So pituitary is generally sort of your nasal line, that bridge of your nose where it meets just below, like in line with your eyes, where hypothalamus is more in line with your eyebrows. So if we look at this, the red bone is the sphenoid bone, okay? The red bone is the sphenoid bone. And it has a little dip in it where the pituitary sits. The sphenoid has 17 muscles or something connected to it that are related to your jaw. So if you think stress might contribute to pressure into your pituitary and hypothalamus, I had this epiphany, I kid you not, 2 weeks ago. My patient came in and she has all these hot flashes and she was doing really well, and they came back and she's gotten so stressed. Her sphenoid and her pterygoids were so tight, and I was like, have you been clenching? She's like, oh, I'm grinding like crazy. And I was like, sphenoid. Oh, why did it come back? Oh, mechanics. So I started to look at that, and even that was just an eye-opening. I was like, you just changed how I looked at the sphenoid even more. And our jaw, and tension, and that stress axis. It's not just hormonal, it can be mechanical. So the pituitary sits underneath this. See that cross? The X? X marks the spot? That's the optic chiasm, where the optic nerves cross. So every time you look right and you look left, you are gliding your nerves over your sphenoid, over your pituitary. And what sits right on top of that is your hypothalamus. So in the basement's the sphenoid, and on the second floor is the hypothalamus. And the main floor are your optic nerves. So when we go to this technique and I talk about moving your eyes, you are helping detangle from the inside out. I might say check right, check left, up, down. I say go around the clock one way, go around the clock the other way. Find the little snag in your fascial system that's important for you, okay? So I'll pass this around if you want, or I can, actually we're gonna go into it. So afterwards, if you wanna look at this more specifically, this is so critical in thinking of mechanics. So now we're like, okay, if you look at pictures of the sphenoid and you look at, or not sphenoid, the pituitary and hypothalamus, they're in deep. How are we gonna touch that? We already know we can touch it with our eyes, and everything's vascular, so there's pressure systems, and intention, and compression. You can engage into things much more than you think. So what I want you to do on yourself first, let's just pick your kneecaps. So I'm gonna sit down for this. Because I want you to have a sense of feeling before we go into this. Put your fingers, and the choice can be like double stack fingers, fingers side to side. You can use your thumbs, whatever you want. But I want you to feel, first if you have pants on, feel your pants. Okay, you feel that layer, and they can maybe move over your kneecaps. Now sink in and feel if you can feel the skin layer on your kneecaps. Okay, that's skin. Then feel the bone of your kneecaps, your patellas themselves. So now we feel the bone. So now I want you, think of like hair by hair by hair to sink in more. So get to the bone and add a little more pressure. And it's gentle, and a little more. Go hair by hair and a little more. And so as you sink in, you're sinking into the bone. And you might feel like one kneecap feels more firm than the other. Okay? Keep sinking in and sinking in and sinking in. And eventually you can almost get through the bone to where you feel like, I feel like where the bone meets that space of the cartilage behind it, behind the patella, to hit either the femur or the tibia, depending on which part you're pushing on. So you can sink in and notice. And just now while you're there, squish one side, squish your right patella and your left. And just notice, does one side feel more firm than the other? They might be equal, they might be different. And then see if you can come out equally as slow. Okay. Did anybody notice one felt more firm than the other? No, my left knee has a lot of history, and I was like, oh yeah, that's a lot tighter than this side. I'm not gonna treat that later, right? Okay, so that is the idea. So now what we're going to do, we'll do pituitary first. So that is at the eye level. You can either use your thumbs or your fingers or double stack. So home either with my elbows on a table or lying down. Here, if you want, you can do this so that you can use your own elbows to work against that. So you have some support and resistance, okay? So that you can really let your head kind of melt on your fingers, okay? So they're close together at midline at the level of your eyes, right where your nose meets your forehead. And so what I want you to do is, again, notice the skin. Sink in, there's some muscle layer there, sink through that until you feel the bone. And then start to sink into the bone. And just add layer by layer. And as you're doing this, just start to notice if one side feels thicker or more dense or has more resistance. I usually like to say, kind of think about sinking in like 8 to 10 layers. So you've got to a nice, slow, deep place until you can't go any further. Once you're there, check with your thumb or your fingers on the right side. Check the squishiness. So compress and release. And compare and check the left side. And go back again. See if you notice if one side feels more dense than the other. And then slowly come back out. Don't say anything yet. We're going to go up to the hypothalamus and check it as well. So move your fingers right up between your eyebrows. Again, if you aren't sure, looking at me, they're just fingers side by side, or fingers side by side. At your eyebrow level, same thing. Go skin, muscle, bone, and start to sink in. Let the tissue invite you in. Once you feel like you've sunk into as deep as you can, check the squish. Check the right side, the compressibility. So compress, release a few times. Check the density. What do you notice? And then check the left side. And then come back out. Okay. How many people had the right side feel tighter than the left? Hands up. I want to see. Okay. And then the others, you felt the left side was tighter than the right. Okay. So I would be curious to feel like.
The hypothalamus or the pineal?
Were they the same? Were they?
Mine was different.
Yours was different?
Mine were different.
Yours were different? Okay. How many of you had the right hypothalamus tight? Okay, not sure. So what I found, and it's just what I found clinically, that every single person that has hormonal disruption or neuroendocrine disruption, the right side was tighter on every single one. I have not found a single left-sided. So just something to think about, something to notice if you go and do this, and especially with somebody who is having hormonal disruption, hot flashes, mood swings, all these symptoms, have them check. Again, like some of this is very new and you're like, well, I'm not sure, did I really feel it? Not what was sore and not what, don't follow pain. It's truly like even on me, and I treat myself all the time, I still have more density on the right than the left. I don't know why. I can't figure that out, but it is a pattern I've seen. So I was just curious what this group is going to show. So we're going to go and treat. We're going to treat the pituitary first. The idea now is same thing of getting there, and once we're there, you're going to focus on that more dense side, whatever it was for you. If as you do it, you're like, wait, no, it was the right, then switch over. If not, you might have other history and it's not hormonally related, okay?
Well, and how do the sinuses relate to that? Because you can have
Sinus pressures and
allergies.
right. But sinuses are much more superficial. So here we're really trying to think, and that's where when we add the eyes, I want you to notice and feel. Where do you feel it? Okay? And it doesn't always have a pattern, like I look to the right and it's tighter to the right. But for me, typically looking right is tighter because my right side's tighter. So just see what you notice in yourself. Again, if you're not having hormonal things, maybe it's not relevant, maybe there's another pattern. But I'm saying on all the people that have definitely hormonal things, it's been the right. So I was just curious in this group. I didn't want to bias you. So get yourself comfortable. We're coming in onto that pituitary, so that's between the eye level. And just settle in and go slow. And take your time. I'm going to give you a couple breaths to slowly sink to that depth.
And whichever side's tighter, kind of slide those 2 fingers to that side a little bit more. Bias that side a little bit. And compress and gather, kind of like wringing out a sponge. You're gathering every little bit of that tissue until it can't compress anymore. Once you're there, I want you to play with your eyes. Play with looking right and notice the excursion. How far can you go? How strained does that feel? Back to the middle, and then look left, back to the middle. Try looking up, back to the middle, and try looking down. And so whichever one of those 4 directions was the tightest, go ahead and look in that direction and compress and release. And just do this slow little like baby CPR, this compress and release while you're looking in that direction. Taking nice slow deep breaths. And I always like to say, as you're looking over to that direction, look far off in the distance. Picture something happy. Imagine something that you're looking at, really looking. And then slowly release and slowly bring the pressure back off. Come back in. We'll do one more. Slowly sinking into that density. And see if you notice, does it feel a little softer? Can you get a little deeper? Check your eyes again. Go for the direction that felt really tight. Does it move a little more? If so, then check the other directions. Pick the second tightest. So whenever you're ready, go ahead and look into that second tightest direction or the same, whatever's left over. Compress and release. Several breaths, several compress, release. Looking off in the distance, picture something happy. And then don't let go of the pressure yet. Come back to neutral and just check your eyes. Look right, look left, look up, look down, and then slowly come out. And see if you notice, did it feel easier with your eye excursion? So come back out. Did anybody feel their eye excursion changed? So you're freeing up that fascia over pituitary. And you were affecting the hypothalamus, but let's be more specific and go up to the hypothalamus. How many in here had to treat the right pituitary? So still not, it didn't change for anyone else. Okay, so let's go up to hypothalamus. So as you come back in, check your squish again. Make sure you're finding your tight side. So this is between the eyebrows. Slowly sink in until you feel like you can't sink any deeper. And then check. Look right, look left, look up, look down. Pick your tightest direction. Add your compress release for several breaths. Again, looking far off in the distance. Picture something happy. Really try to focus on it.
Are we compressing both sides or just our tightest side?
Tightest side. Focused on the tight side, but both sides. So you sort of bias your fingers over that side that's tighter. And then keeping your pressure still on, recheck your eyes. Look right, look left, look up, look down. You can slowly come out if you need a break, or come back in and look in a new direction and do that same thing again. So compress and release. And it doesn't have to be so linear. You could sweep your eyes around the clock, like clockwise and counterclockwise, and just feel like, where's there a hitch? Where's there a sticky point? Look up into that sticky point, far off in the distance, and then add your compress release. And take one more nice deep breath. In through the nose, out through the nose. And slowly come back out. So self-treatment of pituitary and hypothalamus. Breath changes cranial pressure. So you're affecting cranial pressure that way. The compressed release changes the pressure, the vascular system. The eye movement works with the fascia internally. The tentorium and the falx and this double layer membrane crosses that optic chiasm. The pituitary is below, hypothalamus above. So we're treating without really being able to go in and touch it the best way that I know how. There are more specific techniques I'll do in the clinic for cranial facial suture, for the sphenoid, for all of this. And it's a system, so I might have to go and work on fascia around the right ovary or around the adrenal or something else to balance the system. So there's a whole approach to that, but that's much more than I can teach you in this setting. Okay, any questions on that so far?
It was much better, really, when I thought of something really happy. Why is that?
So that goes into the next piece that we're gonna do in terms of our stress system and our safety system and the ability for us, so we use our eyes, our sound, everything to regulate our world, right? So if you are working on something that might feel new or scary, or our system's trying to determine what's going on, and you're picturing something happy, we're tying into our limbic. And I think because of how we orient our eyes for safety, I think it just helps downregulate the autonomic nervous system that way. And also, I mean, if you're picturing something far away and you're really imagining it, you're lighting up different pathways in the brain, and the eyes themselves have to contract, so that different musculatures are firing, the optic nerve and the retina are having to work differently, so that input through the optic chiasm might be more. So I can just theorize. Yes.
Yeah, well, similar to that, and you may have already answered it, within moments of doing what you were coaching us through, I felt my entire nervous system just downregulate, like I am just so chilled out right now. And so I wanted to ask you, what is that relationship between the unwinding of the fascia and the downregulating of the nervous
I think it's
system?
limbic.
Neurohormonal, because it's the fight or flight mechanism that keeps us safe, but it's also, if it downregulates all of that, then your body doesn't, it's safe.
Yeah.
It just
Okay,
feels
so it
safe.
just moved me into a state of deep safety
Well,
very quickly.
and there's,
is that-
they do a lot of different kinds of mechanisms like EMDR, where they
Right, yeah.
where they really look, and if you imagine fight or flight and removing some of the fear of your surroundings like a deer would do, you're just gonna be. So it's interesting that it plays perfectly with that. It's a perfect match.
So the last piece ties into that more. So again,
I was
Go
gonna
ahead.
say, having the pituitary, I have a tumor in between the hypothalamus and the pituitary, so I've done that. But I put my tongue behind my top teeth.
you can play.
And you get the pulse going
Yeah.
faster.
Tongue to roof of mouth, even just normal, our tongue's supposed to be in the roof of our mouth, because even just our tongue touching the roof of the mouth bathes some of that neuroendocrine system because of the pressure against the pituitary. There's so much with mouth closed and nose breathing and all of that. We could go down so many rabbit holes. But let me teach you this next piece. So this next piece is, again, a blend of a bunch of different things. The belief that I have, and you can use this technique anywhere on your body. So I'm gonna show you we're gonna do pituitary hypothalamus together, but you could do it to your liver, you could do it to your knee. Anywhere that your system has been upregulated a little bit because of trauma or anything. We have a back off layer, right? This back off layer, like if a football hit you in the face and a bird flies by, you do that, right? It's our protective system. So if you can bring your hand in really, really slowly and tell your brain, I'm safe, I'm safe, I'm safe, your accommodation of your brain saying, I don't have to filter that, it's not a threat anymore, can change. So that's one component, theoretically, to what we're doing here. The other piece, and the book I brought, and I really like this book for clearing different things. I love Louise Hay, I cross-reference a bunch of things. Ina Siegel has tools for you to go in and bring light into different areas and clear areas and change mindsets, and so it's just this beautiful self-help book. So I blended a little bit of hers and a little bit of mine and a little bit of Baral and a bunch of things into this. But what we're gonna be doing, and so I'm gonna demonstrate it, and then we're all gonna be quiet and do it because it's a self-experience. But you're gonna be, and you can do this while I'm talking, you want to bring your hand in front of your head and feel if there's any area about 4 inches from your head where you feel like there's a blip, a pressure, a sensation, a tingling, a sense of, pressure is the best word I can say. Sometimes it feels like heat, okay? So we just did pituitary hypothalamus, so this is the area we're gonna be doing. And then you're gonna feel, how far out do I feel that pressure zone or heat? Like, bring my hand way out and bring my hand back in really slowly. And where's my wall? Where's my point where I feel like, ooh, I feel that in my head, I feel pressure. Okay, so for me, it's probably about 12 inches. So, once you do that, what you're gonna do, and I'm gonna let us all quietly do this, is you're going to be coming in, again, 1 millimeter at a time, slowly, 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 telling your brain you're safe. You can say clear, clear, clear until you feel a shift. You can say things like, I like to say, I just want to forget this. You can say, please release any negativity or anything I'm holding in my pituitary hypothalamus if you have a certain organ, or in my liver. And then I always say to myself at the end, please heal and regenerate my pituitary or my hypothalamus to its maximal health, vitality, and well-being. And so the language much more is in here, okay? So just take a moment and close your eyes and scan and find your fluffy layer and barrier. And then as you very slowly bring that hand all the way until it touches your forehead, work with whatever language feels good